The patients have had a huge benefit. They've had access to care.
Remove barriers to improve access. That's what Iowa legislators did when they eliminated the requirement that PAs have a supervising physician.
Supervision, with or without, has absolutely nothing to do with our scope of practice. Our scope of practice is defined by our education and the area in which we are practicing medicine.
Removal of supervision can be directly tied to improved access to care at PA Laura Cunningham's mental health clinic. Before, Cunningham spent thousands of dollars each month for a supervising physician who didn't see patients or even live in the state. Since the change, Cunningham redirected that money to hire additional providers. In 2024 alone, her clinic saw nearly 700 new patients.
Now, instead of spending time trying to get things ready for a conversation with their supervising physician, they're able to refocus that time on their patient care. They're able to get more appointments in, and they're able to meet the needs of the patients in their location.
A Harris poll found American adults wait on average 1 month for a medical appointment. For specialty visits, the wait is even longer. But at Cunningham's clinic, it's the opposite. Since the state removed supervision requirements for PAs, 95% of patients seeking a mental health appointment at the clinic have been seen within 2 weeks.
From day one, I felt a lot of confidence in her training and what she spoke to me about, the questions that she asked.
Manuel Acevedo grew up in a family of doctors. He admits he had a bias against any non-physician provider. Now that's gone.
I think that one of the very important things is, especially in underserved communities, is for people to realize that you have a choice, that you just don't have to wait around for the doctor to be available. I am all in favor on every state in the country to allow PAs to practice like they're able to practice here in Iowa.
Dr. Deborah Kimball spent decades working as a radiologist. Today, she's a patient of a PA.
I find that the PAs tend to be more people-oriented, and they will listen, and they will also take the whole person into account. They aren't just like one visit, one problem. They're willing to go the extra mile, and they are willing to ask for help and consultation when they need it.
The debate over whether to remove PA supervision is ongoing in many states. To protect patient safety, some organizations argue all healthcare teams must be led by physicians. Emergency medicine doctor Thomas Benzoni sees it differently.
When I hear people insist on seeing every patient that the PA has seen under supervisory or whatever kind of guidelines that they would like to call it, I wonder if that individual themselves has the skills because they don't trust other people.
Benzoni has spent decades training medical and PA students in both clinical and classroom settings. His expectations for physicians and PAs at the end of the day are the same.
So as long as the person's in the area in which they're skilled and trained, optimal use. If you put them anywhere else, you're wasting their training, frustrating them, and probably not doing a good job with the patient.
Otherwise, there's a 3-month wait to get into some places.
Cunningham hopes other states will follow suit.
The work is not done. We need to continue to push forward and make these changes that we've had in Iowa available to every single state, so every patient has the access to the care that they need and that they deserve.